जनगणमन अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे तव शुभ आशीष मांगे। गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे। भारत माता की जय।
प्रशांत कांबळे सर आपल्याला उपस्थित लाभलेले आहेत ह्या कार्यक्रमासाठी, तर जोरदार टाळ्यांनी त्यांचं सगळ्यांनी स्वागत करावं. आणि मी रिक्वेस्ट करेन डॉक्टर अकोले सरांना प्रशांत सरांना वेलकम करावं. प्रशांत कांबळे सर एक मिनटं. मी प्रशांत कांबळे सरांना रिक्वेस्ट करेन की आपले आजचे मेन स्पीकर डॉक्टर मार्कंडेय सरांना त्यांनी फेलिसिटेट करावं.
Good morning all dignitaries present over here. Our honor of speaker, honor of guest Dr. Markandeya sir, and also we have respected Kamble sir as our Joint Commissioner of Animal Husbandry as today's guest. So I welcome all on behalf of VPWA. And also I am thankful to VPWA for giving me an opportunity to introduce today's guest of honor and speaker, Dr. Markandeya sir. And it's really a privilege to me to introduce respected Markandeya sir. Professor Dr. Markandeya has completed 36 years of university service. He did his graduation and post-graduation from Parbhani Veterinary College. Regularly he was promoted to higher post and has 15 years of service in Professor Cater. He has nearly 5 years of experience as College Dean of Parbhani, and Dr. Markandeya sir has guided 25 postgraduate scholars. He has undertaken 40 different research projects as principal investigator. There are 225 published research papers to his credit. Dr. Markandeya sir has attended 12 international, 30 national and 39 regional conferences, seminars for presentation of lead papers, search papers and session assessments. Dr. Markandeya is a life member of 20 professional societies and dozens other organizations. He was selected for 45 days training to Israel on dairy farming. Dr. Markandeya is invited by many national institutes, state universities, recruitment bodies and KVKs for paper setting. Also invited for lectures, recruitments, career advancements and postgraduate examinations. Dr. Markandeya has many extension activities to his credits. His scripts have been useful to new literates. He has delivered 72 All India radio programs, 48 media programs, prepared dozens of audio-visual CDs and cassettes, published nearly 1,000 popular articles. He has delivered 600 lectures to farmer breeders, conducted 60 trainings program for professional vets, and also presented 160 technical lectures to field vets. He has authorized 14 books in Marathi for dairy owners and one for veterinarians. Dr. Markandeya has been bestowed with ISSAR Fellowship and NABS Fellowship. He is proud recipient of Vasant Rao Naik Award for 4 times, and that is a record. Along with ICAR and other 24 awards, he is honored regularly by different organizations. During his administrative tenure, Parbhani Veterinary College has been awarded A grade by VCI inspection and has marked his footprints with 600 different institutional activities. Before retirement, Government of Maharashtra has appointed him as a member of Gau Seva Ayog, and still he is continuing with his technical service in his retired tenure. And today, he is our guest of honor and speaker to present a topic, obstetrical problems in dairy animals. We are so excited to hear you, sir, whole day. Now I request to respected Professor Dr. Markandeya, sir. Please bless us with a shower of knowledge. Thank you, sir.
Regional Joint Commissioner of Animal Husbandry, Dr. Kamble sir. Our office bearers, Mulekar Saheb, Gaikwad Saheb, and other respected office bearers of this Veterinary Practitioners Welfare Association, honorable members of this association, representatives from INTAS, Polyvet, and friends. Now it is a time for me to have discussion regarding obstetrics and obstetrical cases. I am sure that all of you are more interested in clinical applications as far as the obstetrical problems are considered. And in 4 sessions, we have to attempt this job. You can have seats, please. Sir, please. I will also... Since all you are sitting, I will also take this opportunity to Friends, obstetrics is the science, as we all know, that it is physiopathology of parturition. The first and the foremost thing which is more important, that we have to deal with physiology and also the pathology of parturition, or the events which are related with the parturition. We have to consider this particular act as an important physiological type of act, because parturition, it is directly related with the economics. Safe parturition, if animal smoothly expels the fetus, definitely there will be a gift of healthy calf, followed by ample milk yield from that particular animal. These 2 points are directly related with the parturition, but if the process of parturition is smooth and if it is followed by further smooth type of recovery from parturition, animal is gifted with the next pregnancy. That is more important. That is more important, because relieving of the animal has to occur at the time of parturition. Whether it is smooth or not, whether it is eutochic or dystochic, animal has to relieve from the uterine load. But once the load is out, this particular animal should have capability and efficiency to become pregnant next time, and therefore that particular part is really more important in case of large ruminants, even in case of small ruminants. In Maharashtra, if we consider the situation of the 1 crore 40 lakh cows which are available, and nearly 65 lakhs buffaloes which are available, only 30% animals are becoming pregnant yearly. This is the most important thing which we should underline, that 30% animals are only undergoing this particular obstetrical part, and they are undergoing the pregnancy. 70% animals are empty, and this is a regular situation. In case of small ruminants also, the situation is also not different from this particular thing, because number of animals becoming pregnant in case of small ruminant is also less. Nobody is bothered about the pregnancy in case of large ruminants or small ruminants because we have a ease for slaughtering the animals except that of the cows and the animals which are related with the cows. For buffaloes, nobody will bother. For sheep and goats, we will not bother whether that animal is becoming pregnant or not. And a very precious type of animals we are putting to the slaughter. This is the worst situation. In Maharashtra, I am proud to say that buffaloes are able to complete 19 parturations during lifetime. 19 parturations. This is the ground reality from Kolhapur district. And as far as the cows are considered, it is very important that cows are also completing nearly 20, 21, 22 parturations during lifetime. So this is possible. Everything is possible if the one phase of gestation which culminates through parturition is smooth and normal. Whenever there are obstructions, we will have to deal such a type of cases. And friends, it is very important to note that in case of gestational phase, there are nearly 1.5 dozen disorders and diseases which are limiting the gestation period, and that to the process of parturition. Same is true in case of those animals which are smoothly parturating. Thereafter also there are 1.5 dozen such a type of complicated conditions which are leading to the problems. And therefore, to have smooth type of reproductive activities, we know that in case of large animals or in case of farm animals, cyclic and phasic is the reproduction cycle, oestrus cycles that is going on, and that is followed by the phase, and that is the gestational phase. This particular phase I have divided into two parts. Number one, early and mid pregnancy, first trimester and second trimester of pregnancy. For cows, it is 3 months each. For buffaloes, we can have 3 months, 10 days, 3 months, 10 days each. In case of sheep and goats, it can be 1.5 months, little more than that, 1 month and 20 days it can be. This is followed by the next important phase, and that particular phase is the third trimester of pregnancy batch, which is more important as far as the parturition is considered. After parturition, also there are complications, and these type of things are dealt with the postpartum type of the events. Now, if we consider the next important thing, regularly for all reproductive activities, one will have to consider growth as an important factor. And those animals which are under control of regular body weight gain, those are in the phase of smooth reproduction. Please remember this particular simple point, very important point, that growth is most important. If there is an incremental body weight for the farm animals, they come into the stress, they exhibit the stress, they become pregnant, and if we expect one insemination, one conception, that is also possible. This is also possible very comfortably with one single estrus. Single insemination will lead to conception. Under the earth, under the sun, there is no country where one insemination is resulting into one conception. Little more number of straws are required. 1.6 we consider as ideal, but since under the biological sciences, we will have to increase this particular number, maybe up to 2 inseminations per conception. Now, once insemination is over, we expect fertilization, and in normal cases, in all normal cases, 85% to 90% animals, they undergo fertilization. So after insemination, in normal cases, 85 to 95% is the rate of fertilization. Once this fertilization stage is continued, then that conceptus should get attached to the endometrium, and then this particular attached conceptus should continue its status multiplication status for the development of the fetus through the phase of embryo. Embryonic losses in normal course are 15% to 20%. So 85% fertilization, 15% loss of embryos. Ideally, we are getting 70% pregnancies. That's what we normally expect. If the case is a repeat better one, if it is a repeat better type of the case, fertilization rates will go down to 55% to 65%. So fertilization itself is a problematic. And in case of repeat better animals, embryonic mortality, definitely it is more than that. It is 25% to 30%. So 55 animals, they are fertilizing, and of the 55, if the 30% embryos are lost, in case of repeat breeding, our success rate of treatment, it will go to 30% like that. So considering this type of thing, we will have to move ahead. And under the field conditions, the first and the foremost thing which we can go for considering or noting the pregnancy, that is related with the seed germination test. Excellent test. Under field condition, many farmer breeders, they are using this particular test, seed germination test. Fresh urine in one saucer, water in another saucer, 10 grains where germination is possible. Say for example matki. If there is germination, definitely this particular germination needs to be hindered, obstructed by the pregnancy, and therefore in pregnant cases, urine carrying pregnancy contents, that will not show germination at all. No germination is pregnancy. Incomplete germination is pregnancy, whereas ample germination which is seen and compared with that of the water, that will indicate about the pregnancy status. Milk progesterone tests are available. Those are made available in the market, and those are withdrawn once again. In the days of 1990s, they were interested to have these type of kits in the market. Nowadays, the kits are available in other states, but those are not readily available in Maharashtra. Milk progesterone test, a very tested type of technology, can be undertaken on the farm on day 18th. Day 18th from insemination, Day 21st, if we go ahead, non-return to estrus is the sign of pregnancy. It is consideration as a sign of the pregnancy. 28th day, blood progesterone test. Now this is made available by a Gujarat company. Blood progesterone test, 28th day of insemination. Non-return rate, we are calculating that the animal which is not returning within 30 days of insemination, that we are observing. But see, follow-up on 21st day, 42nd day, 63rd day, and then pregnancy diagnosis, that is the perfect type of the situation for diagnosis of the pregnancy. Any diagnosis of pregnancy, maybe with the seed germination test, milk progesterone test, or blood progesterone test, or even sonography, by 25th to 30th day, sonography is available under the field. And very soon it will be used rampantly under veterinary field. I am sure about it, because people, they are asking for sonographic examination of the animals. In pet practice, you are regularly attempting sonography, but in large animal practice, unnecessarily we are not using sonographic machines because of the fear. And I don't know what type of fear it is, but still a day will come that people will ask for sonography and will go for diagnosis of the pregnancy. But under the situation, one thing is very important. It is the diagnosis of the pregnancy, which has no value as per the economics is considered. It is confirmation of the pregnancy which is most important, and this confirmation is always, in case of cows, after formation of the fetus. 45th day is the day from which cartilages, hard plates, bones are being formed, and from day 45th onwards, pregnancy is confirmed, and our obstetrical science, it has more relevance with the fetus. This pregnancy period, as we have divided into three parts, like number one, first trimester, second trimester, and third trimester of the pregnancy. The same also can be divided into three parts. Number one, period of ohum. Period of ohum. This period of ohum is 0 day to 18th day nearly. 18th day to 45th day, it is embryonic period, period of embryo, and from 45th day up to term, this is a period of fetus, period of the fetus. In case of animals, it is very important that this type of multiplication starts after conception. Conception, it leads to a multiplication of that particular conceptus, the cells of the conceptus, and slowly there is a growth and the development. Conceptus is not quiet. It is always secreting some or other type of substances which are very, very important for continuation of the pregnancy, All factors which are leading to degradation of the conceptus, number one. Number two, all factors which are leading to disrupt the supply of progesterone, such a type of factors are released by the conceptus, and there is an indication that now pregnancy is going on. Please keep the situation safe. Please keep the uterus safe. And this is not only at the hormonal level, this is also at immunological level. Immunosuppression is the most important part that is played by the factors which are secreted by the conceptus. This part is very important. Friends, progesterone is the first and the foremost consideration, and in case of cows, we know one thing, that this particular progesterone is required for continuation of the pregnancy, continuation of embryo, implantation, maternal recognition of pregnancy, and everything. Progesterone is not the all thing. There are many other factors which are also supporting the pregnancy, and once the conceptus comes in closure with that of the endometrium, it is a dialogue of 3 to 4 days. It is not that with the first, look at the first sight and then there is a marriage. This will never happen. Initially, there is interaction, followed by engagement, followed by some meetings, and then there is a marriage. Gifts are also important. So this particular period of dialogue is very important, and that dialogue period is the period of maternal recognition of the pregnancy. Minimum 6 to 7 days are required. Even if the conceptus comes in closure with that of the endometrium, that part we should understand. This part is important because attachment is different thing, and maternal recognition indicating that yes, there is now going to be establishment of the pregnancy. This is another thing. Maternal recognition of the pregnancy never indicates the attachment. It indicates that yes, there is every chance of attachment, and slowly these endometrium and the conceptus, they come together. From this particular part onwards, cyclicity is stopped. Cyclicity is stopped. And at this juncture, we should understand that cyclicity is stopped, means the signs are stopped. Follicular developments are not stopped. Follicular developments are not. Follicular development, it is a continuous physiological process throughout the gestation and throughout the life. Once animal becomes breedable, 10 follicles, this is for example, those are regularly shed for the growth and the development throughout the life at the interval of 10 days. In case of cows, this is a hypothetical type of example that 10 follicles, they will grow constantly, 10 follicles. Now, with these type of follicles, if there is a growth and the development, always there is a chance that this progesterone which is available in the bloodstream may be hampered, and there are problems related with the level of the progesterone. This is possible at every level. On 21st day, if animal fails to return to the service, The one thing is only confirmed that yes, there is termination of corpus luteum, which was formed after the first ovulation, the last ovulation. This is confirmed. Yes, CL luteolysis is over. But if animal fails to come into the estrus on 21st day, it is indicative that yes, there was fertilization. It was followed by initiation of process of maternal recognition of the pregnancy, and there are chances of some growth and the development of the conceptors in case of the animals. These type of animals which are failing to repeat the cycle on 21st day, they are coming into the estrus on 25th day, 30th day, 35th day, 40th day, like that. And if an animal fails to come into the estrus 21st day onwards, it is indicating that this particular conceptus is growing, but it is being hampered during the phase of growth and the development. So we have to consider early embryonic mortality in those cases where the cycle length is increased beyond 21 days. So this is the first and important part as per the differentiation between cyclic and early embryonic animals death cases. This maternal recognition of the pregnancy is important part where the chemical messengers are important, and those messengers are estrogen, progesterone and estrogen. These are not the two different things. This is one and the same thing. Only it is Ardhanari Nateshwar. Once it acts as a progesterone, next time it acts as a estrogen. But it is the phase. Some peptide hormones are secreted by the conceptus in case of the mare, whereas in case of cows and the ewes, this interferon, this is the most important thing which avoids luteolysis. It avoids luteolysis. Therefore, this is very important that if this factor is there, no CL is regressed. Interferon, tau, TAU, interferon tau. So this part is very, very important, and endometrium is basically responsible for communicating recognition of the pregnancy. Follicles, they will develop. Ovary will not stop its function, but limiting for the follicular development, it is important to understand that follicles, they will develop, but they will not mature. They will grow, they will develop up to secondary stage, tertiary stage, but there is no mature Graafian follicle, there is no maturity, there is no premature development of pre-ovulatory follicle development in case of the ovary. So if we consider these things, then once there is attachment of this conceptus with that of the endometrium, slowly placentation starts. And this particular process is the first organogenesis process, which is very, very important as per the continuation of the pregnancy is considered. Coruncles, these are the spots where there are crypts. And embryo will get differentiated into different type of parts, different type of layers, which will involve in the formation of the placenta, So this particular process initiates by day 33rd, 34th, and thus this particular embryo has its existence as far as the pregnancy is considered. There are many type of parts. You can just check the way in which it is, but we know that in case of cows it is convex, and in sheep and buffaloes it is concave, and in case of mares it is diffuse. Every time the same type of structure is there. It is not limited to coruncles. Microcotyledonary type of placenta in case of the mares. Now this is the part where our session starts. Early embryonic mortality we have to discuss. Number 2, irregular estrus. It may not be a gestation, but it may be irregular type of the estrus. Gestational estrus, animal is pregnant and then animal is coming into the estrus. Threatened abortion, chances of threatened abortion by 130th, 140th day. Then abortions are possible during this particular period, first and the second trimester of pregnancy. Mummification and maceration of fetus. in the first phase by 150th day, 180th day, this is possible. Gestational stress leading to abortion, but it is a stress where the growth and the development may not be proper. And the last one is the ectopic pregnancy, which is true or primary type of the pregnancy. These are the things which we have to cover one by one, where we should start from embryonic type of mortality. Embryo getting developed but unable to continue its existence during pregnancy. This is very, very important one. And in these cases, animals are irregularly cyclic, number one. Number two, the inter-estrus interval is prolonged, very, very important. Inter-estrus interval is prolonged. It is not 21 days, but instead of 21 days, it is something like 30 days, 35 days, 40 days, and so on. This is most important. In this particular period, whenever the embryo is growing, it is a delicate type of structure. And this delicate type of structure needs to be maintained by two important facts. One is immunosuppression, very, very important, number one. And number two, hormones, that to the progesterone. Many animals, they don't have strong type of corpus luteum. Strong corpus luteum is unavailable in case of the cows. This particular corpus luteum, if we want to make it strong since beginning, then we will have to think the day on which there is ovulation. Because once there is ovulation, the cells of the follicle, they turn lutein type of the cells, because LH increases. And it is the LH which brings about the corpus luteum, which forms the corpus luteum. And therefore, to make the corpus luteum strong, GnRH is the best therapy. Receptal or Gynerich, 2.5 ml, please remember, we are making this CL strong, 2.5 ml Gynerich, along with that of the insemination. This will suffice the purpose for making the CL strong. We can make this particular CL strong not only on the day of the estrus, which will help definitely for ovulation and synchronization of insemination and ovulation, but we can inject the same type of hormone very comfortably on day 3rd, day 4th, day 5th, because this is the period of generation of formation of the corpus luteum. And therefore, if we inject Gynerich on 3rd day, 4th day, 5th day, more LH will be available, and this LH will form the corpus luteum. What we are injecting is important. We are injecting chemicals. Gynerich or Receptal, these are the chemical type of ingredients, and therefore we are not disturbing endogenous hormonal profile. But this particular chemical is stimulating for endogenously available, means which is available in the body, luteal hormone, luteotropic hormone, LH. So LH, which is available in ample quantities with the anterior pituitary, it is released. It is made available for the development of the corpus luteum. Endogenous availability of hormone will not lead to any type of complication, and it will form the CL. This is number one. Number two important thing is that if this particular CL is insufficient, say for example, this particular CL is developed, CL is supplying progesterone, but the source of the progesterone and the quantity of the progesterone is less, which is expected for the conceptus, then do we have any other alternative? Yes. Because on day 10th, animal will once again come into the estrus. Follicle will develop. This will not ovulate. This will not ovulate, but it will degenerate. Some crossbred cows, they are always seen in estrus on day 10th. This is a very common type of the thing, that animal was inseminated before 10 days and now animal is showing the this type of estrus. That particular follicle, if we hit with that of the GnRH, day 10th, GnRH on day 10th, definitely it will be useful for formation of additional corpus luteum, additional corpus. And the same thing happens in case of mares. The same thing happens in case of mares. Accessory corpora lutea are developed in case of the mares. So this second CL, that the second follicle, which is not going to ovulate, but it can be luteinized with the help of GnRH, and then we can very well go for additional support of progesterone. If we are not satisfied with this type of approach, then in case of continuation of the pregnancy, ready-made progesterone is available in the market, and one can use ample progesterone. Whatever you want, that much you can use in case of the animals. And the stage for using the progesterone is the stage when CL is fully developed, and the fully developed CL is on day 7th. So day 7th, day 10th, and day 13th. Day 8th, day 12th, day 16th, day 10th, day 15th, day 20th. You can have your own schedule and you support the progesterone. Progesync, isn't it, sir? Progesync is available in the market. The one vial, you can, it's a 3 ml vial, but requirement is not that much. Please remember, because 750 milligram is not required in case of the early embryonic continuation of the pregnancy. You can go for 100 microgram, you can go for 150, and as per the buffalo, as per the cow and her body weight, you can slightly increase up to 250, but one single shot should not be more than 250 milligram of hydroxyprogesterone. So if we go with this, definitely their continuation of the pregnancy is possible. Another important factor which is important as far as the continuation of the pregnancy is considered, and that is uterine temperature. Uterine temperature must be normal. It must be normal, and therefore to control the uterine temperature, dairy animals needs to be in the environment of 20 degrees to 30 degrees throughout the year. If we maintain 20 degrees to 30 degrees for all farm animals, definitely that can maintain the temperature, intrauterine temperature, and the possibility of embryonic losses, those can be reduced. Now, there are 3 different type of phases. The early embryonic mortality is possible on 15th to 17th day, and this will not much affect the length, but remember, 17th or the 18th day is the most crucial day when all lethal genes, they kill embryos. Lethality, genetic lethality is on 18th day, that's all. Whatever is the loss, that is an early loss, and nature does not want any type of abnormal type of the embryo or fetus to grow, and therefore lethal genes, they discontinue the pregnancy on day 18th by 18th, number 1. Number 2, embryo recognition. Once this 18th day is over, then there are the days of embryos, and in this particular day, it is very important that progesterone should continue. The level of the progesterone should continue, and in the recognition of the embryo, cycle length should increase from 21 days onwards to 30 days. Late 35 days onwards, a mature type of embryo, by sonographically we have confirmed that this particular animal is pregnant, but still if that animal is going for embryonic type of losses, nutritional deficiencies we can consider. Always consider nutritional type of deficiencies, and therefore after insemination, it is good practice to advise, number 1, mineral mixtures for minimum 20 to 25 days. Energy which is readily available for farm animals is through good, GUD, good. Second number, small quantity for cows and buffaloes, 100 grams. Chip quality and stored type of material is required. Not type of organic good is required in case of the animal. So if we go for this, definitely we can reduce the things. This is another important thing, that the timing of the losses, 1 to 7 days, we cannot directly assess this, but chromosomal abnormalities are more during this particular period. In the 7 to 21 days, the losses, as I have told you, that 15 to 25% losses are there, and growth may be retarded. 21 to 28 days, this is very important. Say for example that embryo is already developed, It does not mean that regularly it will grow and from 45th day onwards it will be a fetus. It is not like that. Retarding growth of the embryo is quite possible in case of large animals. Retarding growth of developed embryo is possible in case of embryopathy, that is called as embryopathy. This is more common in case of litter bearing species. Litter bearing species. 3 kids born, 2 are weighing 2 kg each, but the third kid is weighing only 1.25 kg. This is embryopathy. This particular embryo will remain constant, static for the growth and the development for a period of 10 days, 15 days, 20 days. By the time it is getting supply of hormone, supply of nutrients, supply of favorable environment, and once it gets the environment, it will also start development like other two. But by that time, other two might have gone ahead as per the growth and the development. Embryopathy is possible in case of the litter bearing species, and many complaints are there, sir. This particular cow is delivering the calf now after completion of period by 20 days, 25 days. Embryopathy. A phase comes where the growth and the development is not a constant process. It stops, and this is only possible during the embryonic period. So that also we have to consider. From 28th day to 35th day, very important that we can check the pregnancy nowadays by sonography, milk progesterone test, and thereafter if there is a death, then we can at least indicate some type of reference of embryonic mortality. Now, considering these different type of causes, the animals which are not under the stress, animals which are favored with the progesterone support, they have very smooth type of embryonic development and growth, and these animals can very well carry the pregnancy up to 1.5 months. Very important one. The next one, that treatment aspect, nutrition, and this NSAID. Whatever interferon tau I have told, that particular part we can have with the help of this NSAID. On day 12th, remember on day 12th. So if you go for these type of injectables on day 12th, definitely this will help for supporting the pregnancy. As per the schedule is considered, I have already given you this particular schedule. GnRH at the time of AI. GnRH, HCG, people they go for HCG, human chorionic gonadotropin. This is a hormone. Hormone we can replace by GnRH. Body is carrying ample LH, so no need to go for such a type of protein hormones, because these protein hormones, they may develop antibodies against it, and therefore it is always preferable to go for GnRH. Same thing on 11th to 15th day for accessory corporal lutea, and then P4, that particular support also we can give from day 5th onward, day 7th onwards actually, and we can have the embryonic continuity for as per the development. This part is more important because under the field condition, repeat breeding cases we are treating with this, and therefore please remember that this COX-1 and COX-2 enzymes which are inhibiting the prostaglandin synthesis, this particular part is very important, and if there is no prostaglandin synthesis, CL will continue and embryonic development and growth will continue in case of the animal. This is the treatment for even repeat breeder animals. This is the treatment for repeat breeder animals. After embryonic development, the next part is irregular stress. In buffaloes, there is a term that is called as the post-service anestrus. Animal comes into the stress, we are providing insemination or the natural service to that buffalo, and that buffalo goes off the cyclicity, This is not the case in case of cows. In case of the cows, there is a delay, and this particular delay is only because of delayed involution or the carpoluteal regression. The CL will not respond to the endogenous prostaglandins, endometrial prostaglandins. Endometrial prostaglandins may be limited to cause the luteolysis. And anything is possible in case of the hormone. Production may be at fault, release may be at fault, recognition may be at fault, and action may be at fault. Please remember all four things for all hormones. It is not that once there is a availability of the hormone, it should act. No. The organ may not respond to that particular hormone for want of receptors, because hormones, they work with the receptor, and therefore this particular problem occurs. Irregularly animal comes into the stress 30th day, 40th day, but in these type of animals you will never get seed germination test positive, you will never get milk progesterone test positive, or even 21st day you will find that the some cyclic activity is available and it is related with CL. It is related with the CL. So these things are there in case of irregular type of stress. In case of cows and particularly crossbred animals are problematic as far as this confusion between early embryonic mortality and irregular stress is considered. This is followed by gestational stress. Gestational stress. Animal is confirmed as a pregnant. This is number one. The first and the foremost thing is that animal is confirmed as a pregnant. We are confirming the pregnancy in case of cows at the stage of 2 months, 2.5 months max. In case of buffaloes, 2.5 months, 3 months max. And once this pregnancy is confirmed, that simply means whatever losses they are going to occur because of the accidents, those will be noticed by the owner. Hereafter, losses will be noticed by the owner. Before that, if there is a loss of the embryo, if there is a loss of this particular pregnancy, resorption is possible. Resorption of all embryonic parts, membranes, and also the fluids is possible, and therefore there is no guarantee about the pregnancy. And owner, we cannot give any proof to the owner, but hereafter it is possible. 100 days to 130 days. This is the 5th or the 6th stress after insemination. If we calculate with the 21 days interval, animal shows the signs of the stress. Animal is not at all at fault. This gestational stress is seen only in case of healthy animals. Number one, healthy animals can only show gestational stress. This is the net effect of follicular development. Regular follicular developments are responsible for gestational stress. When owner says that animal is in stress, it simply means all 30 signs of the stress are evident. Everything is evident. All 30 signs of the stress we expect in case of the animal. No problem. Follicle is growing. Animal is showing the signs, but animal is pregnant, and therefore the name is gestational stress. If we go for parental examination, number one, asymmetry of the horns, once again we are observing. Second important thing, fluctuations with the gravid horn we are observing. Premitus we are observing. Premitus starts by 100th day, that we are observing. We may not be able to reach up to the ovaries. This is most important. We may not be able to reach up to the ovaries. But if we can, if we just attempt, or if we accidentally come across the ovaries, then two things are confirmed. Number one, CL of the pregnancy, that is CL verum. CL verum is 100% available. And second important thing is the developed Graafian follicle, developed by which these type of signs have been exhibited. In the process of regular follicular development, 10 days interval, a follicle will develop. Animal will show the stress because of estrogenic activity. The estrogen comes from the developed Graafian follicle, and this particular follicle is culprit for all signs of the stress. All signs of the stress. Our important consideration is that whenever there is a CL, no insemination. Whenever there is a CL, no insemination. This is the rule. This is the rule in any animal. Whenever there is only follicle, we have to go for insemination. Whenever there is a CL, no insemination. Whenever there is a follicle and CL, no insemination. And therefore, mid-cycle estrus of 10th day, where also we find the follicle and the CL. Gestational estrus, where there is a possibility of both follicle and the CL, no insemination is possible, and we are not going to inseminate the animal. Confirm the pregnancy. Let there be n number of clinical manifestations of the estrus by the animal, strong type of the estrus. Withhold the animal at the doorstep in loose housing type of managemental practices, and these signs they will subside. The signs they will subside. Very, very important. Signs will subside. The stage will complete within 24 hours, 36 hours, and thereafter animal will safely continue the pregnancy. Important thing is that never inseminate any animal as per the recommendation or as per the observations of the owner, animal owner. This is most important. Let there be a mob of 100 people along with the animal, that this animal is showing the discharge, bellowing, tail raising, and so many other type of things. You are not inseminating this particular animal. You are the best judge to check whether the animal is fit for insemination. Gestational cervix remains closed. That is more important. No disturbance as far as the pregnancy is concerned. That estrogen will not create any type of problem. But if you are doubtful, if owner is doubtful, inject progesterone. Once again, inject the progesterone on the same day. But progesterone is not the treatment whenever there is an increment in the level of estrogen. Please remember, many veterinarians, they use progesterone amply whenever there is a case of retention of placenta. Unnecessarily estrogenic level is high. If we are injecting the progesterone, that will be a fault. In case of prolapse, considering that the estrogen level is high, lower down that particular level with the help of progesterone. That is not required. Here, just to avoid the chance, we can have one single injection of progesterone. That will suffice the purpose, but it is up to the consideration of the particular veterinarian, considering the condition of the animal. No ovulation is most important thing about thing. The next part is threatened abortion. Animal is pregnant, gestational estrus is over, owner was confused regarding the insemination, doctor has given assurance about the pregnancy. Now the same animal, after maybe 15 or 20 days, by 150th day, 160th day, anything before 6 months, is reported to the clinics with the complaint of restlessness. Animal owner will indicate that this particular pregnant animal is showing restlessness, animal is showing strainings, animal is showing a very altered type of the behavior since last 12 hours, 13 hours, 14 hours, and there we have to attend the case. Rectal examination will confirm the pregnancy. Number one. Animal is disturbed because of many factors. It is not only the progesterone, but there are many other factors which are disturbing the psychology of the animal. But owner is disturbed because of this. If there are real uterine contractions, and if we are doubtful about such a type of the case, the threatened abortion has only treatment of progesterone. From that particular point onwards, 3 to 5 injections, 3 injections to 5 injections, 1 ml progesterone at the interval of 3 days, 1 ml of progesterone at the interval of 5 days, 7 days. It is as per your convenience. But this will avoid the threat. It is only a threat. It is not abortion. It is only a threat. And that particular threat we can avoid with this type of threatened abortion cases. Many cases are there where the nutritional deficiencies are there, managemental stress is there, nutritional stress is there. Owner will never report that what type of stress animal is suffering from, but he will only say that no, this pregnant animal may abort, and therefore I have presented this animal for your observation and for your clinical advice. Abortions are very, very common. We are going to discuss abortions in 2 parts. Few abortions during the first and the second semester of the pregnancy, and then the brucellosis that will take up in the next part, because brucellosis always abortion takes place in the third trimester of pregnancy. After natural service or artificial insemination, brucellosis is possible or abortions are possible. Abortions which are in the first and the second semester of the pregnancy, of which the first important one is campylobacteriosis. Campylobacteriosis within first 3 months, and this is called as the flying herd infection, flying herd disease. Vibriosis, earlier it was called as flying herd infection, bacterial type of condition. Animal will repeat, and the characteristic is subclinical endometritis. The disease is characterized by subclinical endometritis, fetid type of discharge, thick, viscous, whitish, yellowish type of the discharge, and animal will continuously show such type of discharges at an interval of 15 days, 30 days, 35 days, like that. The cycle continues for a period of 6 months, 7 months. Continuous type of cyclicity with such a type of turbid discharges, and it is self-limiting. Very important thing is that it is self-limiting. Campylobacteriosis is self-limiting. After many cycles of infected type of the estrus, animal will regularize the cycle with clear type of discharge, because with the self-immunity, definitely this animal will come to the normalcy, and animal will be off the infection. Campylobacteriosis. Considering the possibility of this particular bacterial organisms, almost all doses, frozen semen doses, we are using streptopenicillins, streptomycin penicillin, that even if there is any possibility of vibriosis or campylobacteriosis, let there be streptopenicillins. And this practice is going on since last 50 years, uninterrupted. We have not changed. Sometimes we have switched over to the polymyxin B, but then once again we have shifted to this. Considering the antimicrobial resistance, there is necessity to consider for this streptomycin penicillin, which may have a very limited role as far as controlling this particular infection. Second important one is the viral, and during the first 3 months or the first 3 trimester is IBR, infectious bovine rhinotracheitis, respiratory type of the condition. Animals, they have tendency to leak the external genitalia, and therefore the infection will spread from one animal to another animal. If animal goes to the vaginal passage, same virus will cause infectious pustular vulvovaginitis, and the condition is limited to this particular vaginal portion only. Granular vaginitis, necrotic vaginitis, and vaginal pustules are observed in this particular case. But this IBR will lead to viremia, temperature, animal is really weak and it suffers a lot, and chances of losses, embryonic losses, are more in case of IBR. Next one is the listeriosis, leptospirosis, tuberculosis. If we go on discussing these things, the sky is the limit, because abortion is not our topic. But please remember that bacterial abortions are more. 55% to 65% abortions are because of the bacterial causes. Fungal, very, very important, fungal. We say that brucella will lead to storm of abortion. Fungal abortions will lead to storm of abortion. A particular farm, maximum number of abortions are only because of the fungal infections. Viral, after each viral disease, 25 to 30% chances where there is no resistance, that will lead to abortion. Parasitic trichomoniasis is most important one, and non-specific means those are not related with the infection. These type of abortions, they will lead to economic type of losses. Whenever there is a loss of the pregnancy, this particular part is more important, and I'm sure that some of the things regarding this campylobacteriosis, you can, that this is the gram-negative type of organism, and in all infectious diseases, Only bulls are carriers. Nothing. Bull is always safe. Bull will never get any type of diseased condition. It will carry the infection with the penis, prepuce and the scrotum, but he is safe. He will live the life very comfortably, and he is free for all natural type of services and or for all ejaculations. And therefore, this part, sufferers are females. Abortions are there, and there are many other injuries to the female genitalia. Permanent type of injuries are possible with this, because cows, they also become permanent carriers. But bulls will not suffer because of this type of coital type of infection. Bovine rhinotracheosis, red nose, this vaccination we have used under the field condition. Bulls are regularly positive. Bulls from frozen semen laboratory are also positive, because this is a viral one. This is a viral type of the disease. This is where we have to consider the viral type of conditions leading to abortions. Listeriosis, gram-positive type of, and where the fodder is soiled one, vestiges of fodders are more, this particular infection is more. Leptospirosis, during wet conditions, whenever there is a flood, definitely this particular condition will flourish, and we will get the abortions. Trichomoniasis is also a parasitic and important one. This part is important for you. Please remember, whenever there is abortion under the field conditions, collection of 7 vials is very, very important. This part is most important. Under field condition, what we can do? We cannot go for laboratory. We can send the samples, and this sample collection is most important thing. This is the part which is related with us. I'm going to circulate this particular PPTs, total PPTs to you. So please remember that this material collection is very, very important one, and within 6 to 8 hours we have to send the samples. With the first abortion, if we send the sample, we are limiting the rate of abortion. That particular part is important. We have to limit the rate of abortion. First sample is sent for investigation. Within a week's time, within 10 days, we will get the result, and that type of treatment measures we can adopt in case of the animals. So this part is very important. The type of the samples from the dam, the type of the sample, I will give you these type of the thing, fetus, and also from the placenta, abortus, placental parts, from aborted fetus we can collect the sample. Simple submission of sample is mandatory. Please remember, mandatory. If we make a single mistake of non-submission of sample to the laboratory, we are at fault, because we do not know what type of infection it provides. If at all it is a non-specific type of abortion, okay, good. Nothing will come out from the laboratory results. But if it is infectious one, we are going to save another type of pregnancies. Once the abortion storms and once the period of abortion we consider during pregnancy, then also there is a possibility of mummification during the period of mid-pregnancy. This is related with the mid-pregnancy. Here, important thing is the death of the fetus. And why there is a death, still death, it is all hypothetical. We do not know why there is a death, but there is death. All factors leading to death of the fetus are responsible for this condition. All factors. Nutritional factors, there may be deficiency of the nutrients. There may be infection, there may be virus, there may be anything, there may be pressure for supply of blood to the embryonic parts, to the placenta. Everything is possible. There are many theories related with the lethal type of genes, sublethal type of genes, autosomal type of the genes. Pinpointing is not there, which is directly related with this particular fact of this mummification. But there will be mummification. Mummification is such a thing where established pregnancy is discontinued without infection. This is very important. When we say that chances of infections are there, viruses are there, SMEDI group of viruses, stillbirth, embryonic death, mummification and infertility group of viruses, SMEDI group of viruses, static type of embryos. So these type of theories are postulated. Clinically, we have nothing to do with this. There is a death of the fetus, that is the final word. And once there is a death of the fetus, the normal procedure of abortion will not take place. The normal procedure will not take place because uterus is sterile. Another important thing is that uterus is sterile. Maximum resorption of the fluids and the fetus becomes more and more a ball. Hard ball formation takes place. In case of animals, if we recommend that pregnant animals needs to be monitored at an interval of 2 months, owners definitely they will say that this doctor is interested in the fees and the parental examination and therefore is asking such a type of practices. But under the veterinary control of pregnancy, parental examination at an interval of 2 months is mandatory in case of the animals. Mummification will be diagnosed earlier and owner will not lose his economics only because of such a type of loss of pregnancy. A more thickening of the part of the fetus, bones cannot be absorbed. Nothing can be absorbed and this particular ball will be there inside the uterus. Seen in all breeds, please remember, seen in all breeds, seen in all type of farm animals, and this condition is not so rare. It comes across many a times. Asymmetry of the horns will be there as per the size of the fetus. No fremitus, remember, no fremitus, no blood supply to the uterus. CL may be utilized. CL by the time may be utilized because endometrium is slowly coming down to its normalcy. Resorption and regeneration of endometrium starts. We may not be able to reach up to the ovaries also, that is also important thing, but there are no fluctuations. Please remember, no fluctuations, no coruncles, no cotyledons, no fetal parts. It's a hard ball. Pregnancy will continue for months together. It will continue for, owner will not be interested to discontinue the pregnancy. This is the ground reality. Under the field condition, owners, they will say that, oh doctor, you may be confused, I will call some other doctor and he will diagnose the condition. So it's okay. But condition remains the same. In case of mummification, it is very important that cervix remains closed, no infection enters, and this particular animal carries the pregnancy for months together. Treatment is more important. In this particular case, the best results are with prostaglandin. We are going for prostaglandin, Pragma, Vetmet, we are injecting. Regularly we are injecting, but there are no results with the single injection. Please remember, single injection will not suffice the purpose. Double injection is required at the interval of 4 days. Double injection at the rate of 4 days. And these 2 injections will also not suffice the purpose unless and until we stimulate cervical dilatation. So once again we will have to go for epidosin, injection epidosin. And epidosin will not respond early. Epidosin will not respond early. It will take 3 days, 4 days. If we inject immediately epidosin through intramuscular route or intravenous route, this will not be sufficient. We will have to inject epidosin drop by drop, as if it is oxytocin, oxytocic units, slow drip. First drop, second drop, third drop, 6 hours, 8 hours drip is required for epidosin to have the effect. In veterinary practice, there is no drug which will bring about cervical dilatation immediately. We are practicing with many other things. Prostaglandin jellies are available. Still there are limitations. Cost is number 1 limitation and number 2 effect is. Cervical dilatation will take maximum time and then the fetus we can remove. in 50% cases of mummification, please remember, in 50% cases of mummification, we will have to go for laparotomy and we will have to take out the fetus through the cesarean section. Because hardening is so tight that even after opening of the uterus, detachment will lead to bleeding. It will lead to bleeding. So this particular condition, why it happens, we do not know, but it happens. And whenever we come across such a type of the cases, unless we are cleaning the uterus with total expulsion of uterine contents, the cyclicity may not start. But once the contents are removed, within a month or so, animal will start the cyclicity. This is also true. In case of small ruminants and litter-bearing species, there are confusing type of observations. One fetus will undergo mummification and other two fetuses are very safe. One will undergo mummification, other two are safe. All three, they will undergo mummification. Everything is possible. It is limited to a particular fetus. It is limited to particular death of the fetus. If the fetus remains live, no chance of multiplication, no chance of mummification. So with many parturations and with many kiddings, after birth of a live kid, you may get mummified type of the fetus, and therefore never consider that this expulsion is total. There can be retention of mummified type of fetuses in case of sheep and goats. This is also important. Sheep and goats. Generally, after birth of the first or the second kid, we are through. Okay, thank you. Everything is out. It is not like that. If a small type of mummified fetus is there, it will take time to come out. This is most important. Now, this condition has a similarity and with that of the maceration that we are going to discuss, but these are some of the causes of mummification, that everything will indicate that pregnancy is discontinued because of the death of the fetus. Two types. Hematic, it is more blood related in case of cows, and papricious, it is related with the other type of species where chocolate colored, dark chocolate colored type of the pest is added, and the single fetus in a tunnel will get that particular pest. Treatment remains the same in almost all the species. Now the next condition, which is simulating to this mummification, is maceration. Death of the fetus is the first thing. Then there is invasion of wound infection. Invasion of wound infection. Bacterial organism, pus-forming bacteria, all pus-forming bacteria, they will enter inside the cervix, into the uterus, and a big pus will be formed inside the uterus. Big pus will be formed. It will take time. It will take 2 or 3 months for formation of total pus. Pyogenic organisms are there inside the uterus. So once there is a formation of pus, asymmetry will not be there. Symmetric enlargement of the uterus. Symmetric enlargement of the uterus. In case of pregnancy, always you will find that the tonicity or the growth of the uterus is increasing toward the dorsal side. Dorsal type of elevation you will find in case of pregnant animals. Here, it is not a live fetus. Then nothing is live. Everything is pus, and therefore gravitational things. More and more resting type of condition of the uterus on the pelvic beam that you will find. Gravitate. It sinks. It sinks because the contents are pussy one, dead one. In this particular condition, whenever the pressure of the pus increases, condition is very much simulating to parturition, and slowly internally there is a pressure on cervix for dilatation. Slow pressure on cervix for dilatation, that will lead to discharge of the pus pussy discharge will come out slowly. And once it starts, it will never stop. Day first, you will find something like 5 ml of the pussy discharge. Day second, you will find 50 ml, then 100 ml. And once the quantity of the discharge is increased, it is expected that pittal parts are also passed through this pus. Hairs, then the small type of dissoluted pittal parts, those are also coming through this particular pus. Neglected type of cases will carry 50 to 70 liter of the pus in case of mummification. 50 to 70 liters of the pus formation is possible with this type of condition. But whenever a pregnant animal discharges anything like a pus, rectal examination is necessary and the treatment is necessary. On rectal examination, number 1, no premitus. Remember, blood supply will be there. Blood will be more flowing toward the uterus for formation of the pus, but it is not a premitus, just like pregnancy, number 1. Number 2, symmetric engorgement of both the horns, confusing with that of the twin pregnancy. Number 2. Number 3, heavy feel, duffy feel of the uterus. Heavy feel or duffy feel of the uterus. Leathery feel to the uterus and crepitative sound. If you try to press the bones of the fetus, they will crash with each other and therefore they will form crepitative type of the sound. That part is very important. Any pressure on the uterus will be leading to oozing of the pus. Immediately there will be oozing of the pus. These things, they will indicate that this animal is carrying a pyometra type of condition and it needs to be evacuated. Simple procedure under the field conditions is so simple that if there is a small opening in the cervix, go for Lugol's iodine. Very, very important. Lugol's 3%, 4% Lugol's iodine is very simple type of the thing which will dilate the cervix and also it will try to give some irritation at the cervical part to the body of the uterus and the discharge will come out. Estrogenic preparations we can prefer here. Estrogenic preparations we can go for. Stilbestrol is available in the market. Progganon depot, please remember, progganon depot. 1 ml will carry 10 milligrams of estradiol valerate. 5 to 7 ml we can inject. We can also go for smooth muscle contraction through prostaglandins, pregma. Again, we can go for pregma. But the best results are with the Lugol's iodine. Please remember, Lugol's iodine will give the magic results. Daily go for infusion of Lugol's iodine and it will try to clear the pus. Prognosis of this particular case is always grave. No chance of recovery. Permanent type of infection will settle inside the uterus. And future breeding is questionable in case of maceration. It is only because of unhygienic maternal care during pregnancy. Please remember, it is unhygienic maternal care during pregnancy. And therefore, to keep the animals away from infection, once again, as per our maintenance of animals is considered, the loose housing system is fantastic. Number 1 is loose housing system. Number 2, regular exposure to sunlight daily. That is second important thing. Regular exposure to sunlight. And number 3, most important thing is that keep all cow sheds and buffalo sheds dry, completely dry. Korda gotha and moza nota. Throughout the life, I will continue with this. It is only because if owner wants to cry, he should cry because the losses in the dairy farming, but outside the farm, not inside. The drop should not carry such a type of infection or it should not flourish the infection which is available inside. Single drop is not at all important. And Konkan region and Bombay region requires this particular practice because almost all tabelawalas, they use ample water regularly. I have visited Australia. where our friend is working, Dr. Netke. He is from Jamkhed, maintaining 13,000 cows, 13,000 cows, 12 lakh liters milk daily. No cow is cleaned with the water, it is washed with the water for years together, Daily udder is cleaned, but it is cleaned immediately, it is wiped off. Immediately the person will wipe off the udder after cleaning. No other part is cleaned. And here we are not concentrating on cleaning of the udder, but we are cleaning all other parts because we want to keep this as a Gomata. Keep it like Gomata, but infection should not flourish. That is more important thing. And this is only possible if animals are under this completely dry type of conditions. Maceration is the pathogenesis is more important, and you will find the type of the condition that treatment will definitely suffice the purpose. You can go for PG and estrogenic type of preparations. Gestational stress. Animals are under gestational stress, please remember. There may not be abortion, but if pregnancy is not smooth and if the development of the calf is not proper, then output of the pregnancy is very poor. Please remember, output of the pregnancy is poor. If the weak calf is born, if a weak newborn is available, definitely it will have problems in the fertility during the lifetime. And therefore, no animal should be under gestational stress. This particular point needs to be considered with regard to nutrition. With regard to nutrition, and nutritional changes are very important during pregnancy, during say dry off period, and also during transition period in case of the large animals, particularly the dairy animals. Constant type of feeding will not suffice the purpose. Dry matter intake, it has relevance, and every time we have to calculate the nutrition on the basis of this dry matter intake. We consider that during the pregnancy, this first and the second stage of the pregnancy, generally animals are in milk. During first and the second trimester of pregnancy, animals are in milk. If animals are in milk, 65% should come from concentrates and 35% dry matter should come from the fodder. This is very important because animals are in milk. Slowly we have to go down towards the 55-45, and this is followed to 45 and 55 when we are going to the stage of drying off of the animals. So 3rd month, 4th month, 5th month, these are the executive months where milk production will remain high. During this particular period, maximum animal should get from concentrate. 65% part is from concentrate, 35% part from the fodder, followed by 55-45, and at the time of drying it should come to the next 45-55. And this, then we have to continue with more on fodder during the dry off period, that we'll discuss at the time of transition phase. So stress, if we relieve, definitely the growth and the development of the animal will be fast, and definitely we will get the results for smooth ectopic pregnancy. This is the part. It's both during the first trimester or in the last trimester. In the first part, primary ectopic pregnancy is more important, where the conceptus will not join to the endometrium. On the contrary, it will join with the fallopian tubes itself. It may come out from ostium tubae abdominally, means the part of the fallopian tubes which is toward the abdominal side. It will come out from the fallopian tubes in a reverse manner, and it will get attached to any part of the abdomen, maybe peritoneum. This is a true primary pregnancy. This is a true primary pregnancy. CL is available. It will supply the progesterone, but endometrium is empty, but still this particular condition will continue in case of the animals. This particular condition will continue with the animals, and this is the abnormal type of condition, very rare type of condition, but still animal will continue the pregnancy, and this is a primary true ectopic pregnancy, very very rare in case of the animals, very rare in case of the animals. But judgment we will have to go for per rectal examination. Uterus will be empty, uterus will be empty in this particular case. And friends, this particular condition is not important in case of animals. This ectopic pregnancy is very very important in case of human beings. In case of human beings, please remember, because our pregnancy diagnosis depends upon LH through urine. We are always going for diagnosis of the pregnancy with the urine strips. In case of human being, test will be positive, growth will be outside the fallopian tubes, and a day will come when there is a discontinuation of the pregnancy or bursting of this pregnancy. It will develop peritonitis and death of the human beings. So please remember that this particular test is very very important, and we have to consider this in case of human life. So this is the another type of the condition as far as this test is considered. I think it is 11:30, and we have to start with some special lecture on Shivaji Maharaj, if I mistake not. You just please confirm, and then we will continue once again, because third trimester, parturition, then postpartum amendment, everything we have to discuss. Any difficulty up to this part, short, within a phase of 10 minutes, we can have even questions also. Please. Seed is an embryo. Once there is establishment of pregnancy, these pregnancy factors, they will not allow any other thing to grow and develop as a pregnancy. That is the logic. Those interferon, tau like things, anything which comes out from the concept, that is the thing. Yes sir. नाही आपण म्हणाल तसं, कारण 11:30ला लेक्चर आहे ना कुलकर्णी साहेबांचं, तर ते सुरू करायचं आपल्याला. काय ॲज पर वी विल गो ॲज पर शेड्यूल, काय प्रश्न. जर कमी पडला वेळ तर आपण पुढं जाऊ, पण तिथपर्यंत ठीक. इस्ट्रोजन, प्रोटीन बी, ह्या सगळ्या गोष्टी ज्या काही त्या कन्सेप्ट सीडमधून येतील, त्याच्यामुळे पुढची प्रेग्नन्सी होत आहे. प्रेग्नन्सी म्हणजे काय, मोड फुटणं येत नाही, जर्मिनेशन होणार नाही. आणि हे बरं का, हे आपल्या शास्त्राला कितीतरी वर्षांपूर्वी माहीत होतं, म्हणजे एन्शियंट काळापासून माहीत होतं हे सायन्स. 12व्या-15व्या दिवसापासून ते 60-70 दिवसापर्यंत प्रॉबॅबिलिटीज वरतीच आहे. 80%, 70% रिझल्ट येतात, इट एफिकसी आहे. रिपीट बेटर ॲनिमल्स असतील आणि जर इरेग्युलरिस्टस असेल तर चालतं. आपण लास्ट टाइममध्ये आपण बोलूच साहेब, पण असे 240 दिवसानंतर नाही. 240 हे लास्ट लिमिट, काही प्रश्न नाही, कारण त्यानंतर इस्ट्रोजनमध्ये कन्व्हर्जनच सुरू होतात. रेअर आहेत. परवा सांगलीची एक केस होती, आपले तिथले फील्डचे लोक होते, त्यांनी विचारत होते की सर दिलं आम्ही प्रोस्टाग्लॅंडिन पण ते काय आलं नाही, आता काय करायचं ते सांगा. म्हणलं नाही, एकदा देऊन भागणार नाही, दोनदा द्यावं लागेल. मग दोनदा दिल्यानंतर इपिडोसिन सुद्धा दिलं. किलारमध्ये होती केस, ते सक्सेसफुली बाहेर पडलं. काय एवढे थिक होऊन जातात आणि एवढे डिले असतात की मग ते युट्राईन कॉन्ट्रॅक्शन्स होण्याच्या पुढच्या गोष्टी प्रोस्टाग्लॅंडिन किती होणार, इट इज व्हेरी, फार कमी प्रमाणामध्ये कॉन्ट्रॅक्शन्स होतात प्रोस्टाग्लॅंडिनचे, पण तरी झालंच आहे ना. हा जो पिरियड आहे मॅटर्नल रिकग्निशनचा, की जिथपर्यंत अटॅचमेंट आहे, तर तो प्रत्येक स्पीसीजमध्ये खूप वेगळा वेगळा आहे, खूप वेगळा वेगळा आहे. आणि याच्यामध्ये अनलेस देर इज अ डायलॉग, देर इज नो कनेक्टिव्हिटी. This dialogue is established from cell to cell, surface dialogue is there, and then it is a tubular dialogue. असं तो व्हायला खूप दिवस लागतात. म्हणून ते 5-6 दिवसाचा पिरियड काऊज मधला आपण बघितला. बाकीच्या स्पीसीजमध्ये याच्यापेक्षा जास्त पिरियड आहे. साहेब 35 दिवसाचं तर प्रेग्नन्सी पिरियड आहे माझ्या माहितीप्रमाणे ह्याच्यामध्ये रॅबिट्समध्ये 35 डेज. आणि फक्त पेक्युलॅरिटी जी रिप्रोडक्शनची आहे तर ती इंड्युस्ड ओव्हुलेशनची आहे. वन्स देर इज अ मेटिंग देन ओनली देर विल बी ओव्हुलेशन इन केस. हो लाईक हां, तर ते असं असल्यामुळं म्हणजे इंड्युस्ड आहे. पण पहिली प्रेग्नन्सी असताना दुसरी प्रेग्नन्सी होणार नाही होणार, कारण लिटर साईजही बरीच असते त्याच्यात सुद्धा. 3-4ची तर लिटर साईज असते, त्याच्यावर जास्त असू शकते. तर मग ते मग 2 एकदम होणार नाही काही प्रश्न. एक टर्म कंप्लीट झाल्यानंतर दुसरी काही प्रश्न. जिथं इन्फेक्शन आहे तिथं आहेच, काय प्रश्न आहे. बरेच जण एकट्यानेच कृत्रिम रेतन करतो म्हणतात, मी एकटाच इन्सेमिनेशन करतो म्हणा. मग ती गन जर इकडे इकडे लागत असेल वजनल पॅसेजला, स्टराईल सगळे शीत आहे सगळं आहे, पण फक्त मध्ये पास करत असताना वजनल इन्फेक्शन वी हॅव कॅरीड टू सर्व्हिक्स, दॅट विल लीड टू सर्व्हिसायटिस. इन्सिमिनेशन ही गोष्टला 2 माणसं लागतातच, मिनिमम 2 माणसं असल्याशिवाय इन्सिमिनेशन होतच नाही. बरेच जण मग ते आम्ही एकटा करतो, मग कुणी माणूसच नाही, मग काय करणार असं चालू असतं. ऑलवेज असिस्टन्स इज नेसेसरी टू डायलेट द लिप्स सो दॅट द गन विल डायरेक्टली गो टू द सर्व्हिक्स. पण सर्व्हिसायटिस जर असेल तर पुन्हा आपल्याला अँटीबायोटिकला जावं लागेल, काही प्रश्न नाही. पण रिस्पॉन्स मिळतोच अशातला भाग नाही. व्हजायनल इन्फेक्शन, युट्राइन इन्फेक्शन अँड सर्वायकल इन्फेक्शन इज अ मिक्स्ड इन्फेक्शन. जितके अँटीबायोटिक आपण देऊ तितके कमीच आहेत. ग्राम पॉझिटिव्ह ग्राम निगेटिव्ह याचाही पुन्हा विचार, एरोबिक अॅनारोबिक याचाही विचार करावा लागतो. त्याच्यामुळे कॉम्बिनेशन थेरपीला जास्त रिझल्ट. कॉज कधीच सांगता नाही येणार सर, कारण बरेचदा म्हणतात की प्लासेंटल सर्क्युलेशन डिफेक्टिव्ह आहे, प्लासेंटामध्ये जो ब्लड सप्लाय तिथून होत राहतो तर तो डिफेक्टिव्ह आहे. कुठलीही गोष्ट विच इज लिडिंग टू डेथ ऑफ द फिटस इज द कॉज फॉर इट, पण देर इज नो स्पेसिफिक कॉज. बऱ्याच ठिकाणी बुल इफेक्ट आहे का हेही बघितलेलं आहे, पण देर इज नो बुल इफेक्ट, म्हणजे मेल साईड सुद्धा नाही तसं. काऊजमध्ये जास्त, काऊजमध्ये नाही 2-2 वर्ष सुद्धा. कसे मध्ये का जनावर तपासल्यानंतरचे जे काही फीस द्यायची असते तीच प्रॉब्लेम आहे ना आपला. तो जर नसला तर मग खूप मॉनिटरिंग चांगलं साहेब. 2 महिन्याला तपासलंच पाहिजे, त्याच्याशिवाय ह्या गोष्टी कळणारच नाहीत. आणि इफ यू वॉन्ट अश्युअर्ड प्रेग्नन्सी, इफ यू वॉन्ट अश्युअर्ड काप, तर मॉनिटरिंगला काही फारसा अडचणीचं नाही काही. इवन परक्टल एक्झामिनेशन बिफोर पार्च्युरेशन 15 days इज नेसेसरी. त्याच्यावरती आपल्याला साईज ऑफ द फिटस आणि साईज ऑफ द पेल्विस हे कळू शकेल, आणि मग एफर्ट्स घेता येत राहतील. ॲक्च्युअल डिस्टोकेच्या वेळेस करण्यापेक्षा 15 दिवस अगोदर झालेलं चांगले काही प्रश्न सर. पीएच आहे ना, ज्या वेळेस नॉर्मल पीएच हा डिफर होत राहील, ॲसिडिक किंवा अल्कलाईन होत राहील, तिथं या सगळ्या फॅक्टर्स येणार. मग ॲनॉयन जे आहेत सगळे कॅटायन जे आहेत त्याच्यामधला डिफरन्स जर जास्त असला तर हा पीएच आपल्याला दिसणार आहे, असणार आहे. युट्राइन पीएच इज मोस्ट इम्पॉर्टंट. टेम्परेचर जसं आहे तसं पीएचचा सुद्धा फॅक्टर आहे काही. एंडोमेट्रियल मिल्क मधला पीएच जर अल्टर्ड असेल तर तिथं कन्सेप्शन होणारच नाही तिथं काही. एंडोमेट्रियल मिल्क मस्ट बी नॉर्मल, इट शुड हॅव न्यूट्रिएंट्स. आणि न्यूट्रिएंट्स म्हणजे शेवटी काय आहेत, दीज आर दी न्यूट्रिशनल पार्ट्स, ज्याच्यामध्ये काही प्रोटीन्स असतील म्हणा किंवा त्याच्यामध्ये काही असलेले बाकीचे मिनरल्स असतील म्हणा. याचा डिफरन्स फक्त जास्त असू नये, तो नॉर्मल असा एवढं अपेक्षित आहे. त्या केसमध्ये नक्कीच कन्सेप्शन होणार नाही काय. नाही, रिसेप्टिव्हिटी आहेच मॅडम. इस्ट्रोजन म्हणलं की रिसेप्टिव्हिटी आहेच. ॲनिमल विल ॲक्सेप्ट द सर्व्हिस, बट 100% आहेत. एनिथिंग विच विल डिसलॉज दी सर्वायकल सील दॅट विल लीड टू अबॉर्शन. आणि नॅचरल सर्व्हिस नंतर होता. AI नंतर लवकर होईल, नॅचरल सर्व्हिस नंतर थोडंसं उशिरा होईल, 4 दिवसानंतर होईल, काय प्रश्न. पण ते चान्सेस आहेत, काय प्रश्न. प्लीज 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 एकच. हो. तीन महिन्याला सर्व्हिस दिलेली होती, सध्या होती, बरोबर. असं आहे सर की इफ इट इज अ डेअरी ॲनिमल, प्रोफेशनल म्हणजे जे डेअरिंगमध्ये जे काही ॲनिमल्स ठेवलेले आहेत तिथं ॲबॉर्शनचे चान्सेस 100% आहेत. पण जे नॅचरल आपल्याकडचे जे नॉन डिस्क्रिप्ट वगैरेचे जे ॲनिमल्स आहेत ज्याच्यामध्ये रेजिस्टन्स फार जास्त आहे, त्याच्यामध्ये ही शक्यता थोडीशी आपल्याला कमी समजता येत राहील. पण मी खात्रीपूर्वक सांगतो की पेनाइल सर्व्हिस will definitely injure the cervix. Penals will injure the cervix and that will lead to abortion. दिसला नाही काही ह्याच्यामध्ये. हा नाही, तुमचं ऑब्झर्वेशन परफेक्ट आहे. ते लोक असं सांगतात तुम्ही 5 महिन्याची चूक आहे, 3च महिने झालेत, कारण त्या 3 महिन्यापूर्वी सर्व्हिस दिलेली होती. अ, 60 दिवसानंतर म्हणजे पहिल्यांदा जेव्हा इन्सिमिनेट केली आणि त्याच्यानंतरचे जे तुमचे 5 महिन्याचे ऑब्झर्वेशन्स आहेत तो पार्ट, आणि 3ऱ्या महिन्याला सर्व्हिस दिलेला पार्ट, 3ऱ्या महिन्याला 60व्या दिवशी जस्टेशनलिस्टच नाही. इट इज ऑलवेज इन द 3rd or 4th month ऑफ द प्रेग्नन्सी. 3rd or 4th month ऑफ द प्रेग्नन्सी सर्व्हिस होईल. ओनर आहे पाहेल, तोही नोट करून ठेवेल की नाही आज सर्व्हिस झाली म्हणून, कारण ते फॉल्सच आहे. दॅट इज अ फॉल्स वन. तुमच्या ऑब्झर्वेशन तेच सांगतात की नाही 5 महिन्यापूर्वी झालेलंच बरोबर आहे, काही प्रश्न नाही. अबॉर्शनच्या बाबतीमध्ये इंजुरी टू द सर्व्हिक्स इज द इम्पॉर्टंट फॅक्टर असं आपल्याला करता येतं, म्हणजे दॅट कॅन बी कन्सिडर्ड. प्लीज. 37 डिग्री सेंटीग्रेड 30 सेकंड हे जे आपलं प्रमाण दिलेलं आहे त्याच्यामध्ये दोन्हीतही फरक नाही, ते एकच. तुम्हाला जर टेम्परेचरच्या बाबतीमध्ये म्हणायचं असेल तर ज्यावेळेस आपण हे करतो ना ग्लिसरिओरायझेशन, तेव्हाचं टेम्परेचर जास्त महत्त्वाचं आहे. तर ते कमी ठेवलं जातं आणि ग्लिसरिओरायझेशन जास्त वेळ बफेलोच्या बाबतीमध्ये सिमेन प्रोडक्शनच्या वेळेस ठेवलं जातं. थॉईंगच्या वेळेस मात्र कुठलाही फरक नाही. that indicate there is vaginitis. बबल्स दिसलं म्हणजे वजनायटिस आहे. कोविडिन आयोडीनची ट्रीटमेंट गरजेची आहे, काय ती फार महत्वाची. बबल्स दिसतात त्याच्या केसेसमध्ये काय. डोस पाहिजे. I will accept this with one important the point that we have to go for scientific practices. We have to go for science. Yes, but they can. छान. In case of buffaloes, the duration of the estrus is 24 hours for Murrah, Surti, Mehsana, and all milch breeds. Nondescript and other breeds, they are in estrus for 16 to 18 hours. Additionally, night heats are more common in case of buffaloes. So once buffalo is in estrus, it needs insemination. It needs insemination. ते जर झालं तर मग प्रेग्नन्सी नक्की मिळेल. आपला क्रायटेरिया जो आहे तर थर्ड फेज ऑफ द इस्ट्रस असा आहे. थर्ड फेज ऑफ द इस्ट्रस आणि ड्युरेशन ऑफ इस्ट्रस जे आहे हे सांगण्याची प्रिलिमिनरी जबाबदारी ही मालकाची म्हणजे त्या ओनरची. ओनर हॅज टू रिपोर्ट फोर थिंग्स. नंबर 1, this animal is showing incremental body weight in the last 3 observations. 10 दिवसाच्या अंतराने 3 वेळेस ऑब्झर्वेशन घेतले त्याचं वाढतंय ही पहिली गोष्ट. Now today animal is in estrus after 21 days of the first which I have recorded. ही दुसरी गोष्ट. Duration of the estrus is 16 hours, 20 hours, 24 hours. ही तिसरी गोष्ट. And the discharge which is there, it was clear in the last estrus and now also it is clear. Then only the animal is fit for insemination. हे जर आपण आपण नाही नॅचरलमध्ये तर काय माहिती का सर, जेवढे काही सिमेनचा डोस सर्विक्समध्ये गेला तर तिथल्या बंकर्समध्ये तो राहतो आणि मग ओव्हुलेशन केव्हाही हो, 12 तासांनी हो, 10 तासांनी हो, 14 तासानंतर हो, एक बॅच पुढे जात राहते. इट मेक्स अवेलेबिलिटी ऑफ दी स्पर्म्स आणि म्हणून मग त्याचे चान्सेस जे आहेत कन्सेप्शनचे ते जास्त आहेत नॅचरल सर्व्हिसमध्ये. असं काही कारण नाही सर, उलट तर स्टॉल फीडमध्ये जास्त असायला पाहिजे कारण आपण न्यूट्रिशनल मॅनेजमेंट बायोस्टिम्युलसचा रोल आहे सर, बायोस्टिम्युलसचा रोल आहे, पण बायोस्टिम्युलसचे डिसएडव्हान्टेजेस तितकेच जास्त, डिसएडव्हान्टेजेस तितके जास्त. ग्रेझिंग ॲनिमल्समध्ये ॲनिमल इज लूजिंग मोर एनर्जी फॉर ग्रेझिंग दॅन व्हॉट इट इज. हां, मुक्त संचारमध्ये कंट्रोल ब्रीडिंग आहे ना, मुक्त संचारमध्ये बुल्स नाहीच आहेत, बुल्स नाही, त्याच्यामुळे मुक्त संचारला काही प्रॉब्लेम जास्त नाही. चांगली गोष्ट आहे जर इफ दॅट फॉडर इज हॅव्हिंग गुड न्यूट्रिशियस व्हॅल्यू अँड इफ द ॲनिमल्स आर अवे फ्रॉम इन्फेक्शन डेफिनेटली ॲनिमल्स दे विल चाल नाही चांगलं. तो चांगला राहतो. येस, मी थोडं नेहमीसाठी बॉडी वेटवरती हे स्ट्रेस देतो साहेब, कारण ते जर इन्क्रिमेंटल असेल तर कन्सेप्शनचे चान्सेस नेहमीसाठी चांगले असतात. ग्रेझिंग असो किंवा कसं असो वाढत चाललं पाहिजे. कमी होत चाललं की मग बरोबर ते कन्सम्पशनचे चान्सेस कमी होत राहतात. काय कुठल्या स्टेजला होतात अबॉर्शन? सगळे जे स्पेसिफिक अबॉर्शन्स आहेत त्याचे चान्सेस आहेत असं सांगता हरकत नाही. सगळे त्याच्यामुळे हे जे 7 सॅम्पल्स आहेत ना, जेव्हा तुम्हाला पहिला अबॉर्शन झाला तेवढे 7 सॅम्पल तुम्ही इन्व्हेस्टिगेशनला पाठवा आणि आपल्याला पाहता येत राहील, काही प्रश्न नाही. पण प्रत्येक अबॉर्शन्समध्ये पुन्हा काही टेस्ट आहेत. प्लासेंटा कसा आहे त्याच्यावरती सुद्धा कळतं की समजा येल्लो कलरचा असला तर लेप्टोस्पॅरोसिसचा असू शकतो. एडिमेटस जर प्लासेंटा असेल तर तो ब्रुसेलोसिसच्या बाबतीमधला असू शकतो. असे 7, 8, 10 क्रायटेरिया आहेत. तर ते सुद्धा आपल्याला पाहता येतात. अर्ली जर असतील 3 महिन्याचे किंवा 5 महिन्याचे तर ट्रायकोमोनियसिसचा आहे का ते बघा. पस असेल तेव्हा जास्त असेल तर ट्रायकोमोनियसिसचे चान्सेस आहेत. अशा सगळ्या वेगळ्या वेगळ्या गोष्टी आहेत. त्यामुळं आपल्याला त्या पद्धतीनं पॅथोग्नोमोनिक जे आहेत ना ते तर तेवढे पाहावे लागतील आपल्याला. काय प्रश्न मॅक्सिमम पॉसिबिलिटी ब्रुसेलोसिसची असते तर आपण ब्रुसेलोसिससाठी त्याचं पहिल्यांदा इन्व्हेस्टिगेशन करून घेणं जास्त गरजेचं. हां हां ऑक्सिटो अच्छा. चांगले रिझल्ट्स आहेत. आणि त्या अँटीबायोटिकच्यासाठी आता गव्हर्नमेंट लेवलला साहेब परवा कमिटीमध्ये ओझोनचं चालू आहे. व्हेरी सून वी विल गो फॉर ओझोन थेरपी म्हणजे इन केस ऑफ लार्ज ॲनिमल. तर त्याचं आहे रेट कॉन्ट्रॅक्ट लेवलला आलेलं आहे. सर काय प्रश्न नक्की होणार आहे ते काय प्रश्न. काल परवाच साहेब म्हणून लागले होते की मी ते रिकमेंड केलेलं आहे. मग काय प्रश्न आहे. आणि ल्युगॉल्स तर अनिस्टसच्या केसला ल्युगॉल्स, रिपीट ब्लिडिंगच्या केसला ल्युगॉल्स आणि बाकी इन्फेक्शियस केसला ल्युगॉल्स सगळ्यात चांगले रिझल्ट्स एकदम खूप चांगला रिझल्ट देतात अजून काय. पण ल्युगॉल सांगितलं की हा ओल्ड व्हेटरनरियन आहे असं वाटायला सुरुवात होत राहते. ते इंजेक्टेबल असे 1516चे अँटीबायोटिक लिहिलं की मग ते खास दिसतं की छान दिसायलाय चांगला डॉक्टर आणि लिहायलाय चांगला असं वाटत राहतं. हो टेराबायसिन आयो